thank you so much for joining us today on the Next Generation Lifestyle Medicine podcast. We're so excited to have you to hear about your experience and learn from your expertise. Um, yeah, just to kick us off, could you tell us a bit about what brought you into lifestyle medicine?
Well, it all started with an autopsy in 1981. I had graduated from California Lutheran College in June of 1980 and wanted to go to medical school, but I knew I needed to study for the MCAT and make some money because I put myself through college, so I needed to work. So I went to work at the Los Robles Regional Medical Center, started off as a lab monkey, and did everything in the medical technology field as a backup plan in case I didn't get to medical school. And then I got promoted in about 6 months to work as a pathologist assistant. And it was wonderful. And every single day, I got to look at and arrange and prepare every surgical specimen that came out of the operating room. I never saw so many gallbladders in all my life. And I also assisted in doing autopsies. And we were a regional medical center, so most of the autopsies were on people who had died from complications of chronic disease. I got to see the inside of aneurysms and heart attacks and cancer and diabetes complications and kidney disease complications and Alzheimer's, and the list goes on. And I also had the distinct responsibility of removing every single person's gastrointestinal tract, esophagus to the anus, and to dissect it and clean it all out by hand. All of it. Now, one autopsy changed everything for me. It was a woman in her mid-70s who had come to the hospital with shortness of breath, and she passed away within a short period of time, few hours. By law back then, anyone admitted within and who passed away within less than 24 hours needed an autopsy to determine the cause of death. The next day, the senior pathologist, Dr. Glover, and I started the procedure with this woman. And as we began, Dr. Glover looked at me and said, "Ruben, take careful note. We may never see this again." And he was absolutely correct. Here was a woman in her mid-70s with internal organs as pristine and as flawless as a newborn. Extraordinary. Everybody else, their omentum, which is the flap that covers the abdominal tract, that was filled with fat. Hers was clear. You could see right through it. Never saw that before. Careful dissection revealed that this woman had an undiagnosed and undetected ventricular septal defect, perforation through the chambers of the heart. And Dr. Glover, having been a surgeon before he became a pathologist, said that this person, most people with that defect, would rarely live past their 20s. Here she was in her mid-70s, having beat the odds by about 50 years. Dr. Glover said, "I need to know more. This is fascinating." And he asked to meet with the family. I got to sit in. He shared what he had discovered. Then he asked, "Please tell me, how did she live?" And the family proceeded to inform us that she was a Seventh-day Adventist who followed all the rules strictly. No meat, no dairy, no eggs, no alcohol, no processed food, no refined sugar. She had a big, beautiful garden in her backyard. It's all it was. Fruit trees, vegetables, everything. She walked 5 miles a day every day for over 40 years that they knew about. She was happy. She was loving. She was kind. She was compassionate. And she didn't complain about anything. She was active in her faith, active in her community. She was loved by so many people. And she was a loving mother, grandmother, and great-grandmother. This led to a whole series of conversations between Dr. Glover and myself about the connection between lifestyle and longevity. He was my first lifestyle medicine mentor because Dr. Glover himself was a runner. He was very much in shape. He was very conscientious about his diet. Every aspect of his lifestyle, he lived it. In fact, he retired at the age of 86. Uh, so we had all these conversations, and he encouraged me to do more research about the Seventh day Adventists. I came across Ellen G. White's writings about the Seventh day Adventists from a long, long time ago. And that's how she started that particular Christian sect. And it was based on biblical principles of being able to be healthy and live a thriving, healthy, happy life by really focusing on how you put the right foods and the right thoughts and the right everything into your body and your mind and your spirit, everything. And then I came across a couple of articles in National Geographic. It was before Dan Buettner actually started working with them. But the seed was planted in my mind. And then I went off to medical school in 1982. And it was confronting for me because the first year we studied normal anatomy and physiology, all well and good, nothing wrong with that. But then as we started looking at pathology, I got to see that the training in medical school was a 3-box system, learning how to assess the patient's symptoms. Got all kinds of tools for that, x-rays, blood work, you name it, and then come up with a diagnosis. And the diagnosis has to also have a code. Otherwise, it's not reimbursable. And then the third box is to then move to the box of treatment. What's the appropriate treatment? That has to be sanctioned and blessed and confirmed by the medical association. That's the training in medical school. The training is not about what caused this initially, what actually led to this situation being the case that it is. When it comes to chronic disease, we have failed in medicine to really look at the underlying root causes. We just look at the treatments of that. And so my advisor in medical school was Dr. Peter Calla, a cellular physiologist, absolutely brilliant. And he was somebody who was fit and loved to work out. And I liked working with him. He was wonderful. We matched up energetically very well. He even had a pull-up bar in his lab. It was great. And I spoke to him about my disillusionment. And I said, I really want to explore the connection between lifestyle and longevity. That is what really fascinates me. How can we actually prevent chronic disease and actually empower people to live a healthy life? He said, you're onto something. This is great. He offered me to step into the MD PhD program, split my second year curriculum, and start my research. And that's what I did. And when I came back with my initial findings, it was really profound because I was looking at the long-term lifestyle history of the chronically ill, easy to find, I just went to the hospital, and the persistently well, and you'll like this one because I was a swimmer on the UC Davis Masters Aquatic Club. So I'm interviewing people in their 60s, 70s, 80s, and 90s who are swimming all the time. And I asked them the same set of questions about their lifestyle habits for the previous 40 years. Do you think there was a difference? Night and day. And when I presented this to Dr. Glover, he said, you're onto something. This is really profound, but we don't have the resources here for you. Why don't you consider going off to the School of Public Health, get your master's and see where that leads you, and you have the option to come back and finish your MD. I said, that sounds great. So that's what I did. Off I went to UCLA and got my master's in public health. And when I finished, I realized I was absolutely passionately committed to promoting health and preventing disease. And I was no longer interested in treating disease, at least not the traditional medical way. And so I chose not to go back to medical school, but to pursue studying lifestyle medicine on my own. I know I was ahead of my time, but that's how it all got started. And then in 2016, I went to a conference, the Plantrician Project, and I went to that conference, and Dr. Leonov, former president of the American College of Lifestyle Medicine, did a presentation on the American College of Lifestyle Medicine. I said, where have you been all my life? And I immediately joined, and I was in heaven. I stepped into my first lifestyle medicine conference in 2017, and it's been absolutely amazing ever since. Okay, you're on.
Okay. So what a journey. That is such like a unique path. And I think it's so interesting, especially for a lot of us who are in medical school or in public health. I have a background in both, but just I love how you paint the picture of doing the autopsies and how you really were fascinated by that connection between lifestyle and longevity. I think that's such an interesting point that you made. And your curiosity and root cause as well led you to public health, which I think makes a lot of sense and really fits that preventative picture. So after your MPH, how do you practice lifestyle medicine now? What do you do in the field?
So I'm an independent practitioner, and because I've been passionate about just empowering people to live a thriving, healthy, happy life. And I've been conducting seminars on health for over 35 years in the community. I still do these. In fact, last year I did a series of 10 seminars at the Carmichael Seventh-day Adventist Church, and they have a beautiful auditorium, and we recorded them all on video as well. It was wonderful. So I've been doing seminars and webinars for the community for a very long time. That's one of the things that I do. I have a YouTube channel that's loaded with lots of material. I've got hours and hours and hours worth of material there. I also do group coaching programs to empower people to actually change their health. And I've written one book already on health called Evolving Health. Dr. Neil Barnard actually endorsed my book. But that was a brief book. It was very quick. I just basically transcribed my seminars and put it into writing. And then I also do individual coaching one-on-one. I specialize in people who have very complicated cases. I have the background from medical school to help me to actually work with people in a very deep way. Plus, I have a lot more training in psychology. I have a master's in behavioral psychology and health promotion. And then I also do lifestyle medicine consultations for people to help them develop a plan to get them started, just a kickstart. Okay, here's the plan to get going. In addition to that, I am going to be certified in the blue zones coming up very soon because I'm almost done with my book, my fifth book. And this was my second book on health, and it's entitled How to Fully Live. And it is a transformational approach to creating a thriving, healthy, happy life. And I can't wait. I'm so excited. I'm just putting on the finishing touches right now. So that's what I do as a practitioner.
That's great. And that book will definitely be added to my to read list. And I love how you approach lifestyle medicine on so many different fronts. You've got the kind of macro level with the books and the seminars, community level with like group coaching, and also individual level. So I really like that you have really so much knowledge and so much experience, and you're really kind of promoting this on all fronts. And just for some of our listeners who might not know about the blue zones, could you kind of tell us a little bit about what they are and
Sure. Dan Buettner, I love his curious mind. I mean, he's always been curious. He was a cyclist coming out of college, but then he found out about these communities of people on the face of the planet that have the highest concentration of centenarians, people over the age of 100. And it's fascinating. So there's 5 communities that he was able to explore. And that's the Seventh-day Adventists in Loma Linda, Southern California, the longest living group of people in the United States. The Nicoya Peninsula in Costa Rica. And then there is villagers in the island of Sardinia in Italy. And then Icaria, Greece is a small island as well. And then another island is Okinawa in Japan. And it's been interesting because the statistics show that on average, I believe it's 20 people out of 100,000. I may be wrong on this. Don't quote me on this. But anyway, it's 20 people out of 100,000 that reach 100 years of age. But in the blue zones, it's 400% more. It's at least 80 people out of the same 100,000 that reach the age of 100. So it's a clearly statistically significant. And we've been studying them for about 25 years and looking at everything in their lifestyle, their diet. In fact, there's a wonderful documentary on Netflix called Live to 100 Years that features Dan Buettner explaining all the different 5 blue zones and what we're trying to look at in other parts of the world and how to actually replicate that and how to actually create blue zones. So what we're trying to do in many parts of the world now is instill the same process of being able to create that community, that environment, because we know environment from the field of epigenetics, we know that everything in our environment affects the expression of our genetics and therefore determines our health. So everything matters. That's why lifestyle medicine is so great, because we look at everything. It's very comprehensive. So we look at how much you're able to walk, how the quality of your food, the air that you breathe, everything that affects your lifestyle affects your health. And it's wonderful. And now we have the partnership with the American College of Lifestyle Medicine and the Blue Zones programs. And it's board certified lifestyle medicine clinicians like myself, and who can now become eligible to become clinicians with the Blue Zones program. And I'm really looking forward to eventually establishing Blue Zones programs here in the Sacramento region where I live. And I've got 2 test sites already established to be able to do that, one through the YMCAs, another one through the Carmichael Seventh-day Adventist Church. And then I visited a place in Austin, Texas. If you ever go out there, be sure to visit a place called Casa de Luz, L-U-Z. So it means house of light. And it is an entire community of practitioners, a wonderful macrobiotic-based, whole food, plant-based, oil-free dietary cafeteria and it's all the tables are long, promoting community, which I love. And so you sit down with 6, 7, 8, 9, 10 other people and have conversations. And by the way, I'm also doing that here in Sacramento. I host a community dinner every Sunday evening from 5 to 7 p.m. at one of my restaurants that has a fabulous whole food, plant-based, vegan menu. It's incredible. So we do that every Sunday. So that's the whole nature of being able to put blue zones, because we know from the research of studying those blue zones that it's not just what you eat, but it's also you move well, you have a lot of strength and connection. We know from the research that social connections and positive social connections is the #1 factor for healthy longevity. And there's also a sense of faith and being able to be really connected to your right tribe. So all those things matter. So that's what we're trying to replicate, which I'm very excited about.
Yeah, that's really awesome. You're taking what you're seeing on a global scale and trying to replicate it in, your local communities, using the evidence that you're seeing. So I think that's really, really cool. And I know we've talked a lot about sort of, how you practice lifestyle medicine professionally, but I also wanted to ask you, you have so much knowledge and you live out a lot of this as well. What is your favorite way to practice lifestyle medicine?
Well, I live lifestyle medicine. So I'm constantly doing this. This is a fit for me. One of the things that's important for everyone listening to this is that we are all leaders, whether we like it or not. And leadership, first and foremost, is by example. If we say one thing and do another, there's no integrity in that. And integrity matters. People will follow integrity no matter what you say. And if you're a parent, you already know this, okay? Because our children will not listen to what we say. They will do what we do. And so it's very important. I love how I get to live this way. That autopsy really hit me hard after I had ruptured my Achilles tendon and put on 55 pounds of weight. And I got basically knocked on side of the head by a friend of mine who called me chubby one day, and that did it. I said, that's it, I'm done. And I realized I knew what I needed to do. I realized I had to make the change inside. I had to change my mindset, my thinking, my attitude, my consciousness and awareness, and I had to take action consistently with that. So I encourage every practitioner who's listening to this that you got to live this. And it's a choice to be able to do this each and every day and each and every way. It's everything. from waking up in the morning, saying your affirmations, is being able to make your bed nice, neat, and tidy every single day, as being able to cook a very healthy meal, is being able to hydrate and make sure you get plenty of water right out of the gate, first thing in the morning. You got to be able to get your exercise in. You've got to be able to do all of it, manage your time, manage your health. And one of the things that we talk about in lifestyle medicine, we talk about those 6 pillars, which are wonderful and absolutely important, but there's more. There's more, because when it comes to being able to empower others as leaders, we need to understand how important it is for us to, number one, lead by example, but second, we need to also have the skill set to be able to empower others to reach their potential. Now, this takes leadership skills. Fortunately for me, I've learned a lot about leadership skills and development. I was a hospital administrator for quite a few years, and healthcare administrator, and I learned a lot about leadership from also coaching high-level athletes for well over 40 years. We have to develop those leadership skills to empower others, which means not only are those 6 pillars important, but being able to teach people how to manage their priorities so they can create a new lifestyle schedule. Being able to schedule effectively. So many people have too much on their plate. So they need to be able to do that. I always tell people, if you don't schedule it, it won't happen. If you don't track it, it won't change. So we need to hold people accountable as well and support them in being able to do that. And those are all very important skills that most people are lacking. The other major skill, as leaders, we need to be able to empower people in their mindset. That means we've got to do the work first. We've got to do the work of really having a strong, thriving, healthy mindset. That takes work. We have to discipline. Leaders are readers. So guess what? Read your books. See them all here? I've got another 2 bookcases out there. So leaders are readers. That means we have to do the work. And 85% of leadership is psychology. We have to be able to get inside people's heads. And if we don't do that, then we're just an expert filled with a lot of knowledge, but no capacity to empower. The name of the game is empowerment. And we need to be able to have the skill set for being able to empower others. That's what lifestyle medicine truly is all about. There you go.
Yes, what a great message. As providers and as practitioners, we need to be able to lead by example and empower others. And I know you have a background in psychology and behavioral, change. Are there any pearls that you can share with us on motivational interviewing and how you get people to make change?
I throw motivational interviewing out the window. That's the model for novices, in my opinion. From my perspective, we have to really learn and master transformational change. That means the transformation is completely different. I tell people it's not about information. It's not about interviewing people to get information about them. No, it's about being able to empower people to transform their lives. And that's a different level. It really is. Don't get me wrong. Motivational interviewing is a good start. It's a beginning, but there is a whole lot more. And so that requires, first of all, learning how to transform our own lives. Now, here's transformation. Transformation in a nutshell. A caterpillar walks out onto a distant branch. And then it stops and spins its cocoon or chrysalis. Now, once it's all encased, what I didn't realize, even though I was a biological sciences major, I didn't know this until years after. That caterpillar will dissolve. It doesn't morphologically change like other insects do. Nor like a frog or like a tadpole going into a frog. No, it's completely different. It dissolves completely, and there are these dormant cells called imago cells that start to use that goop to differentiate into the butterfly or the moth. Now, once it's done with its development, it still has to get out. So it has to use that long, soft tongue to be able to work out a hole and then get out and then stand on and hold on to that chrysalis or cocoon, dry its wings, and then can fly. What we show in the research is that the longer it takes for that butterfly to get out and dry its wings, the longer it will live. Now, that butterfly is not going back to becoming a caterpillar. Nope. That's transformation. It's a complete change. You flip the light switch and the electricity transforms into light. That light's not going back into electricity. It's a full transformation. It's completely unrecognizable from the previous form. That's what our job is in lifestyle medicine, is to empower people to transform their lives, not get a little bit better, different, or faster. No. Transformation. Now, that takes a lot of work. There's a lot of work in terms of being able to understand how to do that. And there are many stages to doing that. It's all mapped out in my book.
Thank you. That's a really helpful perspective. I also did not know about the caterpillar turning into the butterfly and like kind of the biology behind that. So I really enjoyed that analogy.
Yeah. Yeah.
Um, and then I guess another question I have is like, what is a big barrier or common challenge you see a lot of people face when they're making these transformations and big changes?
Mm. There's several barriers. One, if you haven't done the work on yourself and really committed to transforming your life, then you're basically living a lie when you tell people that they need to change theirs. I remember when I was in medical school and I was doing a rotation in cardiology, and the attending physician was overweight and a smoker and berating a patient. And I thought, no, that just doesn't add up, and it doesn't work. We lead by example. So first and foremost, we have to do the work. We really do. It's critically important that we do that. And we have to choose, okay, if I'm going to commit to empowering people to live a thriving, healthy, happy life, then I have to do that. I have to lead by example. That means, okay, if I'm sitting down on my butt 16 hours a day, that's got to change. And I've got to schedule time to go exercise. I got to schedule time to go shopping. I got to schedule time to prepare my food and do meal prep and all that kind of good stuff that really helps set me up for success. I got to schedule when I go to bed. So I go to bed at the same time and I wake up at the same time and I get my 7, 8, 9 hours of sleep every day. And I've got to do this. I've got to live it. And that's the only way, because it has to be authentic. Inauthenticity never works. It just doesn't work. So that's the first barrier. The second barrier that I see that happens a lot, because not everybody's cut out to coach other people. That's nothing bad or wrong about it. Really, no, not everybody is cut out to coach, because this requires coaching. To practice lifestyle medicine, there's many aspects of what you can do and how you can contribute. But if you're working with people, you have to learn the coaching skills. So that's a barrier. Learning how to coach, how to communicate, how to articulate positive change in a really effective manner. That's skill. I mean, you can be book smart all you want. But to be able to inspire people and motivate people in a way that you own it, that you know what it's like, and you can actually lead that is a skill set that we have to develop. That's very important. They don't teach that in medical school, I promise you. The third thing is being able to navigate serious challenges, because we're going to be confronted with them. They will happen. We will get people that approach us and ask us to help them deal with end-stage cancer, end-stage diabetes, end-stage heart disease, and they're at death's door. And that's a real challenge. And sometimes we can help them, sometimes we can't. And that is an emotional challenge for us as practitioners because it's not an easy pill to swallow. And certainly we're faced with that in the hospitals with patients all the time. I mean, if you've ever been in oncology, you see that constantly. So that's a very difficult emotional challenge, is to be able to deal with those kinds of difficult circumstances. And I've dealt with people who's called me up and said, I got diagnosed with pancreatic cancer. The doctors have given me 3 to 6 months to live. How do we emotionally and mentally deal with that? That's a challenge. And it requires a lot of emotional intelligence and fortitude. It really does. So those are the 3 barriers that I see.
And I feel like those are such great messages to kind of wrap up our conversation. I feel like I'm seeing a lot of themes, leading by example, being very authentic, and building those skills of coaching that we might not necessarily get in our clinical training. Is there anything else that you'd like to add that, we should know, or any pearls that you have?
Well, it's a very exciting time in lifestyle medicine. We are at the forefront right now of being able to create a revolution in healthcare. There is something called the law of diffusion of innovation. Lifestyle medicine is not a fad. It's an innovative change. It really is. Now, we know from research, if you watch Simon Sinek's TED Talk, and he talks about this, it's a wonderful thing to watch. It's really great. And he talks about the law of diffusion of innovation it's a bell-shaped curve. And in the first 2.5% of people who grab onto the idea because they see the possibility, and that's all they need to see. That's it. Like, they see the possibility. Yes. And that 2.5% are the innovators. They are the ones who have a vision and they can see when there's no evidence. They grab the idea. The next 12.5% of the population that adopt this innovative idea are the early adopters. Now, we're in that stage where we're crossing over from the innovators, which are all the people who helped found lifestyle medicine, and the critical mass that we're at to now. We've got about 10,000 lifestyle medicine clinicians that are board certified now. We're coming into a critical mass and getting into the early adopters. We're getting into that area. But we've got a ways to go before we reach the tipping point, which is 16% of the population. We're not there. 16% of the healthcare providers in this country being on board with lifestyle medicine. We're getting there, but we've got a ways to go. It's when we reach that 16%, that tipping point, that we get the next large group, which is the early majority. That's 33.5%. That's exciting because that's when people say, haven't you heard? We have this evidence. Why aren't you doing this? And everybody starts to catch on. It's an early majority, and they say, oh, I better get going on this. This is really good stuff. I've been wasting too much time. I better read this publication from the Journal of Lifestyle and Preventive Medicine. I better read this. And so they start catching on. We'll get there. We're not there yet. Now that gets us to the tip of the curve. The next 33.5% are what we call the late majority. They're the ones that say, oh my God, everybody else is doing this. I think I better finally catch on. Okay. We're not even close to being there yet. And then there's still going to be 16.5%, the resistors. They're called the laggards. Okay. They're the ones, they still have rotary phones. They haven't moved. So they resist change. And there are still always going to be those people. So we're at a very exciting time right now because we're gaining momentum. Lifestyle medicine is the fastest growing specialty of the American Medical Association. So exciting. And I'm proud to be board certified. My certificate has a number on it, 00081. That's my number. And now we're over 10,000. So it's very exciting. And to be part of this means learning a lot because there's a lot of change happening. And there's a lot that we can impart to society and our communities and to our families and to each and individual person that we come into contact with. So it's very exciting. Yes. Hold on. Get ready.
Thank you so much for joining us and for, helping with a lot of, telling us about your expertise and all that you've done in lifestyle medicine so far and, introducing more people to it. So thank you so much for all that you do.
Oh, you're welcome. You're welcome. And I'm happy to help anybody who's interested in finding out more about lifestyle medicine and being a practitioner and what does it take, because there's a lot to it.
There certainly is. Thank you so much.
Thank you.